Welcome to Think Big with Dan and Qasim. Join hosts Dan Melnick and Qasim Masood as they explore big ideas, limitless possibilities, and engage with visionaries, entrepreneurs, and thought leaders who dare to dream big, get inspired, motivated, and find practical tips for personal growth. Think big, dream bigger, and ignite your potential.
All right, welcome to Think Big with Dan and Qasim. And if you want to go ahead and introduce yourself, tell us where you live and what you do for a living.
Hi, everybody. Thank you for having me on, Dan. My name is Jena Quinn. I am first and foremost a mother of 3 crazy kids. I am a pediatric pharmacist. A lot of people don't even know we exist. And I, 2 years ago, started a company called Perfecting Peds. And so it's a mouthful, but we provide continuous longitudinal comprehensive medication management services to pediatric patients who are medically complex. So I'm sure we'll dive in a little bit deeper into what that means, but I haven't been able to make that any more succinct.
Awesome. So how did you get the idea to start this company?
So my grandfather was a pharmacist. He passed away, but he was my biggest mentor. He worked at GlaxoSmithKline in Philadelphia. He makes everyone I know look stupid, including myself. He patented over 125 medications or drugs, published over 175 papers. And so he was really the catalyst behind, why I chose pharmacy in general as a profession. I knew I wanted to do something in the medical field, but I wasn't really sure what. My mom was a trauma nurse and said, like, we don't make enough money for what we do. So she pushed me into pharmacy, and I'm grateful for that. So he was really the reason why I chose to become a pharmacist. And then I had a sister who is my best friend. She's 9 years younger than me, and she grew up with epilepsy. And so seeing just how that changed the family dynamic and what it really means to be a caregiver and family member to a child that's medically complex. And then also secondarily see the profound effects of just a medication like Diastat or all of our anti-epileptic medications, how life-changing they were. It was kind of cool. Sidebar, I got to meet the guy who made pharmacist that made Diastat last week, and I was fangirling pretty hard. And we're actually going to collaborate on a couple of things. So life's weird, right? Like I could have never anticipated that happening. But long story long is that's how I niched down to not only pediatrics, but pharmacy. I said that I'm a mom of 3. And throughout that journey, I realized that almost 70% of the scripts that my children got filled at retail pharmacies, I don't want to say a name, were incorrect. I also noticed that was for a few reasons, looking at the root cause. There's pediatricians who are wildly short-staffed. They have time restraints, a massive, usually an average of 1,500 patients annually. They don't have the drug knowledge that a PharmD has just by nature of our background, right? So you have a pediatrician who has maybe 1 or 2 semesters of pharmacology, whereas a pharmacist, specifically a pediatric PharmD, has 4 years of grad school, 1 or 2 years of residency, a board cert, and then decades of experience within the hospital walls. I also at the same time noticed that a lot of our medically complex kids, when they were admitted, that they actually had a lot of medication errors on their meds that they were started chronically in the outpatient world. So my hypothesis after doing a little bit of digging was we're very rare. There's only 1,700 of us in the US. And so my hypothesis, where we had been for 20 years just constrained to the hospital walls, was what if I took us out of the hospital into more of the ambulatory care sites and non-acute cycles of the care, the non-acute parts of the care cycle, and have us follow children longitudinally to provide that safety net on medication management and be that quarterback that really looks at all of their meds and has the expertise, knowledge, and bandwidth to do so. So I know that was very long-winded, but that was the hypothesis and how I got started down this journey of my business called Perfecting Peds.
For sure. So let's just dive deeper. So can you just like give an example of a use case about how one of your customers or I guess patients is using you guys today?
Yeah, so I mean, even I feel like the holidays always bring a shine a light on just how accessible we make our PharmDs, or how accessible we want to be to the families, because we really pride ourselves. So we have a study coming out of our first 102 patients, due to be published in May in the Journal of Pediatric and Pharmacology and Therapeutics. With that, we were able to show a 44% reduction in hospitalizations by having a pediatric PharmD on the care team and following these kids longitudinally month after month. With that, again, I think the holidays always, there's still, the caregivers still need a medical provider. And if you think of like the clinics, they're shut down. So that's like one easy way where we can shine, where we can avoid having a caregiver go to an urgent care or a hospital. And so two examples of what our team did just over Christmas is Christmas Eve, we had one kid on a medication that's called everolimus. It's a toxic medication, but it's like one of those meds that is needed. It helped for rejection and transplant. It helped with this specific patient population in shrinking benign tumors in their brain so they don't have neurodevelopmental effects. And with that comes some side effects. And so our team had canceled the caregiver when they started a couple weeks ago that you can get mouth ulcers. It's called stomatitis. So the caregiver called our Perfecting Peds line, said that they were starting to develop some mouth sores. What should they do? We were able to not only, ensure that it was just at the cusp where we didn't need to interrupt therapy or anything, but through a collaborative practice agreement with the physician, we were able to call in a steroid for them to apply topically to help alleviate and really alleviate not only the pain, but obviously decrease the mouth ulcers. And so had that gone, even for another week, it could escalate it to the child having a decreased PO intake or oral intake because they got so severe. It could have escalated to us needing to stop therapy with this really important life-saving drug. And then the second example is just a child was having constipation. And so just providing a caregiver with an easy over-the-counter regimen to treat the constipation prevented them from needing escalation and days of delaying. And potentially what does cause admissions is constipation as well. So two just easy examples to show, what we can do when we're part of the care team.
For sure. So what would you say is the biggest challenge that you face in your business right now?
So the first, like any journey, it's been a long one. So to give you some historical context, this is the first time it's ever been tried in the United States. So Medicare, to give you kind of like how this idea came, is Medicare requires what's called medication therapy management in all high-risk adults, right? So it's a mandated service for patients who via risk stratification are identified as high risk, right? So you get partnered with a PharmD. They, especially when you have any patient that has multiple subspecialists, whether it's a neurologist, psychologist, pulmonologist, they're all practicing in their little silos, right? You have a generalist or, a primary care doc, a pediatrician who's practicing like in the general field, but they don't have the specialized knowledge of all these medications that the specialist has, right? So a primary care doc, a pediatrician aren't going to touch the specialist meds. Okay. So one of the biggest things is that we're the only one that has access to the whole picture and understands and has the medication knowledge to assess the whole picture. Well, with that being said, in New Jersey, where I started, we're not recognized as providers to bill. So we can't go just like a MD, PA, NP, go get credentialed with the insurance and start billing them. So one of the biggest barriers was trying to figure out a way to get reimbursed for our services. We started very locally at just facility-based level and doing fee-for-service. Then we eventually were able to get in clinics and start getting outside of New Jersey. Minnesota specifically allows pharmacists to be recognized as providers. So the one barrier was, hey, we can't do this in New Jersey. We aren't recognized as providers. We're working actually with the majority leader of New Jersey to change that. So hopefully that request for proposal will go through. But we then pivoted and started in Minnesota, which is a state that we can get credentialed as providers. So we work virtually there and have a ton of patients. Then we were able to operationalize like how we embed ourselves into facilities, clinics, everything. The next major piece, and you know this being a business owner, is it's just like trying to tackle the biggest hurdle in front of you and then jumping to the next one. We have a contract coming up with a major MCO, which was going to give us hundreds and hundreds of patients. So finding the software to support this was a hurdle that we actively just were able to rectify yesterday. And then also trying to make sure we have the finances up front to support the staffing and the training and the technology piece that needs to be in place before the contract goes live. And so, as a business owner, I know you understand this, but we need a massive amount of staff, technology to operationalize this go live for 2/1/24. So, we're in the midst of fundraising, we're in the midst of technology creation and partnering, and so it's been a whirlwind. But our biggest barrier that we're overcoming, of course, is just operationalizing this first time ever where a managed care organization uses their data and we help them distill who are your sickest kids that we can help you manage. And then they actually, for lack of a better word, dump them into a secure, SFTP, and then we work them up. And so it's a lot of first times in the US. So we have, we're figuring it out, but it's definitely required a lot of pivoting.
So as of now, you're primarily just working in the state of Minnesota. Is that correct?
Yeah, we have other contracts in late stages in other states as well. PA specifically will be our next one.
Awesome. So I guess like in Minnesota specifically, like how do you get the word out about what you're offering? How do you get in front of people? Like, do you run ads? Do you call people? Like, how do you, share what you're doing?
So the reason we're strategically partnering with managed care organizations, insurance payers, is that they're able to give us hundreds and thousands of patients. And so we work with them to disseminate a flyer, emails, text messages to say, hey, this is a new service we're offering. They're going to be calling you. So really our sales and marketing is minimal, which I know is like definitely different than a lot of other businesses because we get contracts that are a little bit bigger and allow us to get more patient volume. And then we partner with the payers that help us disseminate services. The other thing, which is timely, is we have a meeting today, and I have no idea if it will go anywhere, but with which I'm super pumped about, the Chief Medical Officer, Dr. Nathan Chumilo of Minnesota Medicaid at 3:00. So I'm super pumped about it, but I think if we work hand in hand with Minnesota Medicaid, because right now we're only catering to some patients here and some patients there in clinics throughout Minnesota. And so our discussion with him today, well, how will we make this a more equitable solution where, if you have Minnesota Medicaid, you have a medically complex kid in some way, shape, or form, you're aware of Perfecting Peds. And just like you're saying, that might take some sales and marketing to get the word out there. But right now it's really partnering with my partner is RN nurse and then 10 years salesman, and he has sold everything and has always managed to be the number one sales guy wherever he was. And he's actually closed our pipeline because it's so full, which is an exciting problem. So right now, just operationalizing all the contracts we have is like where our mindset and focus are right now.
Awesome. So obviously now people are looking for the best use cases for AI. So do you guys use AI in the business? And if not, like where could AI come in and help you out?
I love that. So there's so many instances. It became abundantly clear. I'm a clinical girl at heart. And so I'm learning the leadership part of it. You kind of have to grow into it as your company. We have 15 staff and we're growing. So, I'm learning it's like anything else. It's a learned skill being a leader. Just like a parent, you're like, what the hell am I doing? But you figure it out. And so a part of that is that when I started, I was like so clinically focused on like the patient that it took us a while and adding hundreds of patients for me to realize like we need technology behind this. And we need to also plug into using technicians more, because pharmacy technicians are a wonderful resource. So the realization that we need technology to scale appropriate was like about a year ago. And we actually have a technology partner that we're actively working with. I do want to shout out to Natalie Park from Pharmasol. I don't know if you've been able to meet her yet.
No.
So she's doing pharmacy specific AI task or generation. Her services, their services are amazing. So I've already talked to her about potentially using them, but there's so many ways you can embed AI into pharmacy and into our workflow. Because again, we're all cognitive services. We don't have an actual pharmacy. We don't dispense actual drugs. And a lot of times we're actually taking away drugs through our comprehensive med management services. So an instance would be like having even something as simple as, we call in a script on behalf of the provider. In like 3 days, it automatically AI sends a message to the caregiver. Hey, did you pick up the script, right? We right now manually follow up and ask that question. But if AI could do it, that would save us just that one simple question. And then you could automate. If they say no, you ask why. And if they respond, a prior auth needed, or my insurance isn't covering it, or, Johnny's in the hospital or whatever. I mean, just using AI to ask those simple questions. The other thing, which I have, our team actually embeds a lot of this into our e-care plan, which is the plan we create to share with the caregivers and the providers. But one thing is, using AI to send the caregiver just something as simple as the adverse reactions that they should look out for in layman's terms, right? So, per example of the drug I just talked about before, we know mouse sores are a common one. So had our team not told mom, she wouldn't know to reach back out and say, this is a side effect of the medication. She would be going down all these different rabbit holes trying to figure out, why this is happening. Like a simple one, which is a weird example, is Singular, which is a drug used in allergies, is very benign. But in children, it really has shown that it's not, that it does cause neuropsychiatric changes. And so just empowering them and sending them a little blurb through AI, if you get started on Singular, you let the caregiver know that neuropsych changes can be a side effect. If they occur, you call either our group or the provider. And so there's so many ways that I think you could use AI and technology to scale efficiently and provide the best consistent care to your patient. And that's where we're focused on right now, is how do we elevate the pharmacists so they're just forward facing and facing the patient? How do we use technicians to do the data collection, the med reconciliations? And then how do we use technology to really bulletproof our safety to the patients, our care delivery, optimize that care delivery so that, almost make it foolproof in the way that it's consistent and it's the most optimal care every single time using AI and technology. So there's so many ways you could use it in our services. And that's actually what we're working through right now.
That's awesome. So what would you say is like the one biggest piece of advice that you wish you knew before you started this company?
Oh, God. I mean, you're always naive going into these things, right? So I think it would be, if I could go back, it really wouldn't be anything about like pharmacy, the patients, like all that stuff. Like I will jump through hoops and so will my amazing staff for patients. But I think it would be a little bit less naive in the way that establishing company culture is so important. And I think in the beginning, I was like so focused on, oh, this person's smart, or this person's X, or I wasn't really thinking about the big picture. I feel like I've learned that you can teach people different skill sets, but you can't change a personality. And so I think what I've honed in on just the last 6 months is I just want authentically nice, caring people on our team. And I didn't really understand the importance, and it wasn't really on my radar as something, you're evaluating this person. You're like, oh, they're smart and they get things done. And, they're experts in their field. But it sounds so weird that would be my piece of advice is, and again, I had to kind of work backwards to establish it, is, like culture within the company is so important. And so to me, prioritizing if people are kind and genuine, especially when they're going to be taking care care of our patients and other staff, right? Like just how important it is to have that bond in your staff is something that I would have focused on earlier had I known how important it was. And again, that's just from being a first-time founder, business owner, CEO. So, some things you learn the hard way.
For sure. So if somebody watching this wanted to reach out to you, do you mind sharing your company website or social media, I guess, best ways to get in contact with you?
Yeah, so we have our websites, www.perfectingpeds.com. So simple. I'm very active on LinkedIn. So my handle is Jena, Jena, and then Quinn, so two N's. Active on LinkedIn. We do have also a Perfecting Peds page that's active in LinkedIn, also post on Facebook and Instagram. And a lot of times we just have updates not only about our business, but pediatric medication tips. And then if we're employing too, which we do have a decent amount of opportunities for employment at the moment. But those are various ways you can find us.
Awesome. Well, Jena, thank you so much for your time today. We're rooting for you to have a very successful 2024.
Same to you. Thank you, Dan.
Thanks. All right. Bye.
Bye-bye.